is scary, not knowing what could happen.
Rising fear as California's growing maternity care crisis leaves communities with an uncertain future.
We have hospitals closing all over the state. We have entire counties that have no obstetrical care.
Maternity care deserts emerging, putting pregnant women and their babies at a higher risk.
What if, I don't know, deliver in the car or we just don't make it to the hospital on time? So it puts stress on you for sure.
We're asking them to drive hours across different counties to get to a hospital. That is not safe.
Alternative options shrinking, with birth centers closing at alarming rates.
Like we somehow failed, like the business failed, but we didn't. The business succeeded. The system failed us.
Deepening the crisis as demands for change grow louder.
I think it's important to have a choice and a more available choice.
The California Department of Public Health is listening now.
By passing AB 55, policymakers have an opportunity to restore the rights of pregnant and birthing people to make informed and autonomous decisions in choosing their birth settings and providers.
In California, Bill AB 55 aims to improve access by eliminating some licensing requirements for birth centers.
It should make it easier. It should remove some of the barriers to opening birth centers.
Freestanding birth centers offer all of these things, and when they close, it reverberates through the community.
The motion is due pass as amended to appropriations. Bonta?
Aye.
Bonta, aye. Chen? Chen, aye.
That was so exciting. I have been working on this for so many years. I can't believe the people who lined up in support, one after another after another. There was nobody in opposition. It went so easily. It's amazing to think how long and hard we've been working on this, and that was just a few minutes.
When we got in there, you know, I felt like it was like a sigh of relief, because it was like, I know that like I have all these lovely women around me that are gonna help take care of me. I ended up only being there 2 hours before I actually delivered her. My husband got to catch baby Eden, and we didn't know we were having a girl, so that was exciting. This is Eden, and she was born December 14th, 2024.
Julia Suman welcomed her daughter Eden at the California Birth Center in Rockland.
I never felt scared. I never felt like I wasn't in good hands. I never felt worried for my baby.
We have a very long, very excellent track record of decreased cesarean rates, increased breastfeeding rates, decreased birth intervention rates.
In case of an emergency, Sasaki says midwives are trained and there are protocols in place to transfer patients to a nearby hospital.
Birth centers have very tight risk criteria. We don't want an emergency to happen at our center either.
That's why birth centers are only an option for low-risk pregnancies.
I just wish that every woman could have this care.
But for that, there needs to be a shift to break down barriers to care.
I would have loved to continue it if it was sustainable.
Opening her birth center was a labor of love. For now, her hope is one day all women can choose how to bring new life into the world.
I hope that there is a home birth midwife in every neighborhood, a birth center in every community, and a hospital in every city.
In Sacramento, Carolina Estrada, KCRA 3 News.
And you can see parts 1 and 2 of our maternity care crisis series on the QR code there at the bottom of your screen. Just hit that with your phone. And we also have more information about the groups trying to help bridge the gap for moms who are struggling with care.